I hate my anxiety. Lots of swear words at it. It's like my biggest self-sabotager. People with ADHD have this big time. It's a huge problem. It's probably why we can't, partially why we can't finish anything or do anything for too long, right? For me, it comes with jobs, and it's scary. I've talked about this before. My kids are the most important thing to me. So holding down a job for an extended period of time is like the most important thing that I need to be doing. And it's a big driver for me. I have to think of it often because when I'm working, it's terrible. I feel like I live in fear, right? Anxiety causes fear in my body. Fear of loss, fear of failure, terrible fear of failure. I feel like it's like I expect it to happen, so I fear it happening. It's just a matter of when. So a lot of times I'll quit jobs before I have this irrational fear of it happening, where they get tired of me. And it's like, I feel like maybe when the excitement of the job settles in and people kind of get used to me or don't respond certain ways, I get anxious because I feel like, I don't know, it's like, am I not entertaining enough for them, right? Am I letting them down? Is my divorce coming out again where I'm going to fail again with that? With my failure in my marriage, my failure as a person, you know? So these are the things that I think about when I go to work every day or when I chart, and I know that I'm not charting as well as I should, right? I know my weaknesses, and I apologize a lot to my employers, but I never feel like it's good enough. Like I'm never good enough for them. I'm never good enough for anybody, right? That drives on me. Soon enough I get to a breaking point, and I think that's what happened with my marriage. Felt like my anxiety was through the roof. Could I have gone to get help? Probably. Could I have medicated myself? Probably. Oh, should I have? Probably. Should I now? Maybe. My self-medication isn't the best thing in the world. Oh gosh. You know, your body gets adapted to like alcohol, or your body gets adapted to drugs, and you have to just increase the dosage. How miserable is that? I've worked in psych long enough, you know. People get used to meds. People get used to opiates to kill the pain, and it's just not enough, you know. Your body adapts. Sometimes negatively. But for whatever reason, not to anxiety. And maybe the adaptation has changed, and that's how I'm adapting. But that's not good for my kids, you know? It's not. It's not a stable father for them. How do I give them stability? I don't know how. Do I take drugs until my body acclimates and then bump up the drugs until I don't know. It's terrible. It's empty. It feels like I'm a black hole sucking in everything that's good, everything. It's such a huge weight on my mind all the time, constantly. When I wake up, there's very few days I feel relief from this. only when I'm busy or when I exercise maybe. But I overdo those things, and then I burn out on those things, and then I go for months, years without doing those things because I burn out. Because I don't get the fulfillment like it should. My body gets used to it again. And I don't know what to do. It's like I cry out, my poor employers. I have such a nice personality, you know, like I'm able to get a job no problem. I can walk into an interview and get that job because I've got a good, strong, sensitive, but understanding personality. Like I come off as knowledgeable, but in practice, my anxiety always gets me. It's always going 110%, so I can only keep it down for so long before it overwhelms me. I have to leave again. It's how it is in social parties and stuff. That's the same mechanism. Like I can only handle the stimulation for so long before the thoughts, the anxiety, the negativity that I put on myself overcome me, and I have to leave for a few minutes to come back. Or I have to change locations, or I have to move. That's why I live in a trailer, I think. Again. Just reiterating why I live in a trailer, why I isolate myself. I feel like I can move. I feel like life is, it's claustrophobic. Jobs are claustrophobic, everything around me is claustrophobic, and so I feel like if I live in a trailer, if I live in a house on wheels, if I am homeless, which I have been, that I'll be able to move, change, adapt again, until I become acclimated, and then I have to do it again, and my anxiety levels reach their peak. And it really is a brain deficiency. It's been this way my whole life. I know there are environmental factors that have increased my anxiety and stuff, but I just genetically was built this way, and it scares the crap out of me for my kids. That's why I give them all that I have. Even sacrificing my own well-being for them. That's my natural instinct, right? I pay more than I should for child support because I hope and pray that they have better than I have. They have more of a chance to get away from this mental anguish, my mental disease. Maybe that's why I went to psychiatric nursing, because I understood. I'm comfortable there. I know what it's like with these people. Maybe that's our society in general. We're all have some psych issues. But nobody wants to talk about it. Nobody cares to talk about it these days.